So people who have maybe high blood pressure and they're taking medication, or maybe people who smoke or they have a lung condition like asthma, what would you say about those people's chances of getting high altitude sickness?
That's a really important question. All different conditions are slightly different, but just thinking about the ones you mentioned there, the lung conditions are very important. I guess there's two ways to think about this. One is, do those conditions increase the risk of getting altitude illness, but also does the altitude risk exacerbating those conditions, if you see what I mean? Because there's potentially two problems there. So lung conditions is a very important one. Obviously, this whole situation is being caused by the low oxygen in the environment. That's the problem with altitude. So if you're already struggling with your breathing for some reason, for example, poorly controlled asthma, or some of the long-term conditions like COPD, chronic obstructive pulmonary disease, or other sort of long-term lung conditions like that, where you're already struggling with your breathing, struggling to get oxygen in at sea level, then you're definitely going to struggle at higher altitudes. And for some people, it's probably just not recommended to go to very high altitude. It's a difficult one to answer because it's got to be on an individual basis. But for the long-term lung conditions, it would definitely increase your chances of struggling and potentially getting poorly. And especially for high altitude pulmonary edema, so the fluid on the lungs, that's partly the reason why that happens is partly due to an inflammatory process. So inflammation of the lungs or the lining of the lungs. So any conditions that someone's currently got, like a chest infection or an upper respiratory tract infection, like a sore throat, things like that, or a cough or a cold, they would put you at increased risk of some of these illnesses at high altitude, just because you've already got an inflammatory process going on within the breathing system, and then altitude makes that worse. Yeah.
So if people who have high blood pressure or they have a heart condition, should they be worried about going to high altitude?
I wouldn't necessarily say worried. Everyone's different, and everyone's. I wouldn't be able to give a black and white answer, but they should definitely seek personal medical advice before planning a trip to high altitude, and because it definitely depends on what their blood pressure is and how well it's been controlled, whether there's any other complications from that, and heart conditions definitely need to be sort of advised on a personal basis, because some won't be necessarily as much of a problem where others may be, and it also depends completely on the trip, because when we talk about high altitude kind of starts at around 2,500 meters, but goes to the height of Everest, almost 9,000 meters. So there's a huge range. And also, some high altitude areas of the world are in parts of the world where there's really good medical care, there's really good evacuation strategies and hospitals that people can get to quite quickly, say, for example, in a helicopter. So the risk is a little bit lower for places like that, whereas other places in the world might be really, really remote, where you're not going to get any help if something goes wrong, or it might take days to get to a hospital, so the risk is much higher in that situation. So getting personal advice about your health condition and the trip that you're planning is really important, to sort of put that all together and think about the risks for that person.